Hey everyone, Dr. Mike here. Today we're diving into something fundamental in nursing and healthcare, the head-to-toe assessment. Think of it as a comprehensive physical checkup. It's a systematic way nurses gather crucial information about a patient's health status. This isn't just about ticking boxes on a form. It's about understanding the whole person. A thorough assessment can be the difference between catching a problem early or having it escalate. It's a skill that every nurse needs to master, forming the foundation of excellent patient care. Without it, we're essentially flying blind, making guesses instead of informed decisions. The importance of a meticulous head-to-toe assessment cannot be overstated. It provides a baseline of the patient's condition, valuable for tracking changes over time. Is the patient getting better? Are they getting worse? Are new symptoms appearing? It helps in identifying actual and potential health problems, key to prompt intervention. This early identification often leads to better outcomes for our patients. Furthermore, this assessment is critical for developing an individualized plan of care. Every patient is unique and their health needs are unique. The findings help tailor treatments and interventions specifically to that patient. It ensures that the care provided is relevant, effective, and patient-centered. This personalized approach improves physical health and makes patients feel heard and cared for. It's a vital skill that truly empowers nurses to be advocates for their patients. The head-to-toe assessment begins the moment you first encounter your patient. This is the initial observation phase. Even before you touch the patient or ask specific questions, you're already gathering data. What's their general appearance? Do they look comfortable or distressed? Are they alert and oriented? Or do they seem confused? Notice their posture, body movements, and facial expressions. These initial clues can provide a wealth of information. They can guide your subsequent, more focused assessments. It's like being a detective, piecing together the first parts of a puzzle. This sets the stage for a safe and effective assessment. Once you've made your initial observations, the systematic assessment usually begins with the head and face. Inspect the head for size, shape, and symmetry. Are there any visible lumps, bumps, lesions, or signs of trauma? Gently palpate the scalp for tenderness, depressions, or masses. Assess the hair for distribution, texture, and any signs of hair loss or infestations. Next, focus on the face. Observe for symmetry. Ask the patient to smile, frown, and raise their eyebrows to assess the facial nerve. Look at the skin on the face for color, temperature, and texture. Are there any rashes, lesions, or abnormal pigmentation? Observe for any edema, particularly around the eyes. Check the sinuses by gently palpating the frontal and maxillary sinuses for tenderness. Finally, assess the temporomandibular joint, TMJ. Place your fingertips just in front of the patient's ears and ask them to open and close their mouth. Feel for any clicking, popping, or crepitus. Identifying these issues early allows for appropriate referral and management. Moving on from the head and face, we next examine the eyes, ears, nose, and throat. For the eyes, start by inspecting the external structures. Look at the eyelids for any drooping, redness, or swelling. Check the sclera for its color and the conjunctiva for pinkness and moisture. Perform key tests for vision and eye function. Check visual acuity, peripheral vision, and examine the pupils for size, shape, and equality. Use a pen light to check pupillary response and accommodation. Next, assess the ears. Inspect the external ear for any redness, swelling, lesions, or discharge. Ask the patient about any hearing loss, pain, or ringing in the ears. If you have an otoscope, visualize the ear canal and tympanic membrane. For a basic hearing assessment, perform the whisper test. Finally, examine the nose and throat. Inspect the external nose for symmetry and any deformities. Use a pen light to look inside the nostrils for any discharge, redness, swelling, or bleeding. For the throat, ask the patient to open their mouth and say "ah" to visualize the uvula and tonsils. Section 5, the vital link, assessing the neck. The neck houses important structures like the trachea, esophagus, major blood vessels, lymph nodes, and the thyroid gland. Begin by inspecting the neck for symmetry, any visible masses, swelling, or pulsations. Observe the range of motion by asking the patient to gently turn their head from side to side, tilt it towards each shoulder, and then flex and extend their neck. Note any pain, stiffness, or limited movement. Palpate the lymph nodes using the pads of your fingers in a gentle circular motion. Enlarged, tender, or fixed lymph nodes can indicate infection, inflammation, or malignancy. Assess the trachea for midline position. Deviation can be a sign of serious conditions like a pneumothorax or a large mass. Assess the thyroid gland by palpating it from an anterior or posterior approach. Note its size, shape, consistency, and any nodules or tenderness. Finally, check the carotid arteries carefully. Palpate the carotid pulse, one side at a time, noting the rate, rhythm, and strength. Listen for bruits using the bell of your stethoscope. Section 6. Heart and lungs. Examining the chest. The chest assessment is vital for evaluating the respiratory and cardiovascular systems. Start with the posterior chest, then move to the anterior chest. Observe the shape and symmetry of the chest. Look for any deformities such as barrel chest, scoliosis, or kyphosis. Observe the respiratory rate, rhythm, depth, and effort of breathing. Note any visible pulsations, scars, or lesions on the chest wall. Palpate the chest for tenderness, masses, or crepitus. Assess for tactile phremitis by asking the patient to say 99 while placing your hands on their chest. Percuss the chest to assess the underlying structures. Auscultate the lungs systematically over all lung fields, both anteriorly and posteriorly. Listen for normal breath sounds and any abnormal sounds like crackles, wheezes, or raunchy. For the heart, listen at specific points for the S1 and S2 heart sounds. Note the rate, rhythm, and any extra heart sounds or murmurs. This detailed listening helps identify many cardiac and respiratory conditions. Section 7. The core of well-being. Assessing the abdomen. The abdominal assessment provides insights into the gastrointestinal and genitourinary systems. Start by inspecting the abdomen for contour, symmetry, visible masses, pulsations, scars, striae, or distended veins. Observe the umbilicus for its position and any signs of inflammation or hernia. Auscultate for bowel sounds in all four quadrants. Normal bowel sounds are high-pitched gurgling noises. Hyperactive bowel sounds might indicate gastroenteritis or a bowel obstruction. Hypoactive or absent bowel sounds can suggest peritonitis or paralytic ileus. Listen for vascular sounds over the aorta, renal arteries, and iliac arteries. Percuss the abdomen to assess the distribution of gas, fluid, and solid masses. Tympany is normal over air-filled areas, while dullness indicates solid organs or fluid. Perform light palpation to identify any superficial tenderness, muscle guarding, or superficial masses. Proceed to deep palpation to assess deeper organs and masses. Note any tenderness, rigidity, or masses. Section 8. Movement and more. Assessing the extremities. Assessing the extremities is crucial for evaluating the musculoskeletal, neurological, and peripheral vascular systems. Start with inspection for symmetry, deformities, swelling, redness, bruising, scars, or skin lesions. Observe the skin color and temperature. Check the nails for color, shape, and any abnormalities. Assess the range of motion and muscle strength. Ask the patient to move each joint through its full range of motion. Note any pain, crepitus, or limitations in movement. Palpate the peripheral pulses and note the rate, rhythm, and strength. Check for edema by pressing your thumb against the skin over a bony prominence. Assess capillary refill by pressing on a fingernail or toenail until it blanches. Then release and note how long it takes for color to return. Perform a basic neurological assessment of the extremities. Check sensation and reflexes and observe coordination and balance. Section 9. The final crucial step, documenting your findings and its significance. After completing the entire head-to-toe assessment, the final step is documentation. Accurate and thorough documentation is a legal record of the patient's condition and the care provided. It ensures continuity of care, as other healthcare professionals will rely on your findings. Your notes should be clear, concise, objective, and timely. Use standardized medical terminology and abbreviations where appropriate. Document both normal and abnormal findings. Effective documentation includes the date and time of the assessment, all the objective data you gathered, and any subjective data the patient reported. Be specific in your descriptions. Comprehensive assessments and their diligent documentation are paramount in providing quality patient care. They form the basis for identifying patient problems, formulating nursing diagnoses, and developing effective care plans. A thorough assessment can detect subtle changes in a patient's condition, allowing for early intervention. It helps healthcare providers evaluate the effectiveness of treatments and make necessary adjustments. This proactive approach leads to better patient outcomes, reduced hospital stays, and improved patient safety. Keep practicing, keep learning, and always prioritize your patient.